Welcome to Pathways to Success, where we aim to build and encourage diversity among health professionals. Through casual conversations with trainees and professionals, our goal is to support the social and emotional well-being of aspiring doctors of color. Here, you can get tips on writing personal statements, interviewing, networking, school selections, and much more. Join us as we inspire and nurture the next generation of Black doctors.
Hello, everyone. Welcome to Pathways for Success, where it's our mission to create a community of interdisciplinary, social, and emotional support for the next generation of Black doctors. Again, I'm Dr. Chinwe Iferibe, and I have my trusted co-host.
My name is Grace, and I am a third-year pharmacy student.
Awesome. So we're going to get right into it. Our focus for today is interviews. That step, it's almost like, that last step just before you either walk through the doors of either medical school or graduate opportunities. But it's a really big step that causes a lot of anxiety for some candidates and students. And so we wanted to really take this time to address some of the things that concern students, what worries them most about interviews, and try to bring some or shed some more light to help them prepare for interviews, okay? In addition, Grace, I think we're gonna, go ahead.
We are going to discuss all those things that cause students to have a little bit of anxiety, palpitations about what to expect for interviews. And we want to just dive into all there is to know about virtual and in-person interviews in this day and age.
Definitely. But first, I think it's really important to think about the interview within the bigger context of the whole process of getting into the healthcare field. And so one of the things that, so here's the background, right? There aren't that many African-American providers. And so we have a lot of underrepresented minority students who are looking to apply for medical school. And, they approach us to give them advice, give them some sort of wisdom on how to approach it. And the one thing that I find in the students I speak to is that they're focused and putting so much weight on the interview, right? It's like the end all be all, like, oh my goodness, what if I go and I talk to someone and I say the wrong word, and that's going to be the reason why I don't get admitted to medical school, right? Or what if they ask me a question, the dreaded "tell me about yourself," right? Have you've gotten one of those, Grace?
Oh yeah.
Tell me about yourself, or tell me a time when ... right? And you're sitting there, sweating. You're trying to think of, man, when was the last time I had a story that I could share, right? And sometimes you go blank and trying to figure out how to say the words in the most articulate way to sound intelligent. And one thing I do a little exercise with the students that I talk with. It's like stepping back to think of the interview within the bigger context. And for the most part, I try to reassure them that, the people that you're going to talk to during the interview, they've probably already, no, not probably, they have already reviewed your scores, reviewed your resumes, reviewed your academic, activities, and reviewed any sense of letters of recommendation or thoughts from others, Can you pause this, Lauren? Sorry. Yeah, so what we try to get them to think about is how this interview fits into the bigger process of the whole medical application, path. And so that's one. It's just really thinking about to say, they've probably already reviewed most of those things, and this is really more to get to know you as a person, and not to necessarily assess your clinical skills or assess your your intellectual abilities related to medicine or clinical acumen, but it's really more about the humanity, the human side of you, right? Because time and time again, we're finding out that it's not just about book sense, that provides quality care for patients. You really have to be able to connect with your patients, to be empathic, to be able to just listen. Like just the whole idea of being able to listen is a skill that not everybody either has the ability to do it naturally. And I think most interviewers are looking for that. And so, but the first exercise I do with my students, and we encourage you all, whoever's listening, and you're thinking about, oh my goodness, what's the first thing I need to think about in preparation for my interview, is to say, what am I looking for in a quality doctor? What are some social skills or characteristics that I like in my healthcare providers, and how do I want to represent that? Because I think if you think about those things for yourself, one, it allows you to really think back on how you see yourself matching those characteristics. And then it'd be easier to tie in any sort of storytelling to those qualities that you have already established as a foundation. And then it puts you in the driver's seat too, right? Because it's like, oh yeah, I do match those things that they're looking for in a doctor. And I do have those skills, and this is how I have it. So if you kind of work backwards that way, I encourage them to think through that exercise so that it allows them to have some level of autonomy and empowerment. So that's the first thing. It's just the mindset shift, okay? That it's not just you feeling judged, because I'm not sure, Grace, you're going to talk to us about some of the types of anxiety and types of things that students worry about. But for the first one thing that I've heard is, feeling like they have to say the right thing. And I say, step back, have a mindset and say, this is how the interview fits into the bigger picture. And this is what I'm looking for in a doctor. And then it might address any other emotions that are coming along with that experience. But what have you found are some of the things, the feelings and emotions that students are experiencing in relation to interviewing?
Honestly, a lot of anxiety and worry about the outcome. Like, oh, if this interview goes wrong, I won't get in. Or, oh, if I'm not calm enough, or if I look anxious, I look nervous, or if my palms are sweating, they're gonna notice all these little things that they really will not notice, but that you also can be prepared with. Like the practice and more practice goes a long way. It's kind of like people when they say, oh, it's like riding a bike, right? Where you don't know what you're doing in the very beginning. But if you practice and practice and practice, you don't get nervous anymore. You don't fear of falling as much, in the same sense as practicing for interviews as well.
Mm-hmm.
But in addition, I think what also people kind of get nervous about is like how to prepare and what to bring to interviews and what to research before coming in. Mm-hmm. So I like to ask myself, like, what do I know about this place that I'm going to, this specific medical school or pharmacy school, whatever institution, what do I know about them? And if I don't know anything, look up some things. Why do I want them? They want me, but I also want them. So why is this place a good fit for me? So thinking about those things as well. But also the biggest part for me personally, when I was about to begin interviews, was what to wear. I want to stand out. I want to look cute, but I don't want to be. I don't want to be the brightest,
right? Yeah, nothing wrong with that.
Exactly. I think when I was trying to figure out what to wear for interviews, I was like, yeah, I'm gonna wear a red, white, and blue suit. I'm gonna stand out, and I purchased it. I was ready to go, and I sent a picture to my mentor. They were like, "That's a little bit too loud. You're wearing." You're gonna stand out for sure, but maybe a different outfit, maybe a navy suit, or maybe something that is still has color but is solid. And but red, white, and blue was a little bit out there. Mm-hmm. So things like that, solid colored clothing, nice dress shoes, not showing your toes. I know your toes probably look great, but time and a place, right? Or hairstyles, being authentically you, but so that they can still see your beautiful face and see your reactions and things, especially since sometimes if interviews are online, like they want to see
Mhm.
all your social cues, even if it's limited on the computer. So appearance is one of the biggest things. And even if you're in person, some of the things is the interview starts as soon as you walk in. So as soon as you walk in, there might be a greeter there to greet you good morning, and they might give you a handshake. Can't think of handshakes outside of COVID, but you never
an elbow tap.
exactly an elbow tap. But then that's when the interview starts, and you could be that person that comes in as says hello and like asks them how they're doing before you go in. But you could also be that person that's like, I'm so ready to get out of here, not knowing that person you're speaking to could be a professor, it could be an interviewee, it could be another student,
Preach.
From beginning to end is an interview, and just getting yourself in the mindset that you can do it. You don't want to psych yourself out, don't want to be too confident, but trying to kind of just be you, tap into you. You're a lovely person. You have a few friends here and there that can vouch for you. So I'm sure if you allow yourself to take the tools that Dr. Chinwe has mentioning about just, thinking about what you want to be, what you see the best qualities in, is like a great start. From the dress, second part, and walking in is the third part. So go ahead, Dr. Chinwe.
No. Go ahead. I didn't mean to interrupt.
No, you're fine. I was gonna also mention a key couple of things before like getting into the differences between interviews. It's like the morning of, if it's the morning interview, afternoon interview, people like to skip meals because of nerves sometimes. But you'd be surprised how much a granola bar, an apple, a snack, something can give you the right energy to just tackle on whatever is thrown at you. And the surprise is good sleep as well. Good sleep, good food. Arriving early, but not too early. An hour early is too early. A minute till it begins is too late. So finding the balance. I used to do interviews for my college, and there would always be every once in a while one student that was an hour and a half early, and it's like, we haven't set up yet. We're not ready for you yet. And it's that being too early is just as bad as being late sometimes too.
Yeah, so tell us about that. For the when you were on the committee and you were interviewing and someone came extra early, what impression did that give to you guys? Because I think some students will think that that's a good sign, but give us some ideas of what the committee would consider.
That's a good point. I get that, definitely. Our first inclination was like, oh, okay, we can tell that they're excited and they're ready to be here, but it's also a little bit inconsiderate of maybe we're not ready yet. We haven't set up all the booths yet. We haven't got all of our volunteers. You're here before our volunteers, so there's nowhere to put you. And so then we have to keep you outside so you don't get a head start on anything that anybody else may see. Because on this particular day, our greeters weren't even there yet. So you don't get the full warm welcome that you would have gotten had you come a little bit later, more within the frame of like 30 to 40 maximum minutes early, as opposed to like an hour and a half. So that day they had to wait outside until we began.
That's good to know. That's good to know for some people who are thinking, how much should I show that I am a go-getter, right? Or how much of a self-sufficient or advocate am I in terms of, the presentation and what they think about me. So thank you for that. That's really helpful to know.
Yeah. Actually, do you have anything to add, Dr. Chinwe?
No, I think that you pretty much, you said one thing you mentioned, because when I think about, as I interview candidates in different settings, whether it's with, programs that I'm putting together or for medical school, the idea that you mentioned, don't be surprised that the person interviewing you has already crossed your path. I think it's one of those things where you're waiting for the person with the title to be the person to ask you the questions. But again, we're looking for soft skills. We're looking for, what do you do when the lights aren't shining on you? How do you treat people when people aren't looking? Like just really those things that talk to us about the kind of quality care and bedside manner that you might give to patients. And so, yeah, you be nice and you be courteous and you be respectful to everyone you meet, from the time that even when you get the call, or if you call on to schedule the interview, or ask questions about where you're going to meet, that conversation is an interview. Because what some students don't understand is that for those of us, at the end point in receiving these students to have that discussion, sometimes we've already spoken to the other staff to ask, how was that student? How are they? What was your impression of that student? Because getting almost like a 360 view of the individual is really what matters most than how they present in one time frame. So something you hit it on the nail. Really, just exemplify the kind of physician that will be beneficial to patients, and don't just look at this as an isolated event. Again, thinking about how this fits into the bigger process. It's not an isolated event. But thanks for sharing that. Let's see, what questions? So you talked about being prepared, right? Mm-hmm. And I try to get my students to think about themselves in the driver's seat. You are not just being interviewed, you are interviewing the program as well, because you want to go to a place where you're going to thrive. You want to go to a place where you're going to feel supported. Would you really feel comfortable being in an institution that the person interviewing you just wrote you off because you said you misspelled a word, or you said it in the wrong way, or you were nervous? Even being nervous is a human emotion, is a human reaction. And hopefully anyone coming into a program should expect that you're a trainee, and you're going to have moments in your training that you're not going to know all the right answers. You're probably going to make a mistake at some point, and you want to be able to identify, are you in an environment that will nurture you and support you when you fall, and give you some constructive criticism that builds you but not breaking you down. So put yourself in the driver's seat and have a mindset that you're also interviewing the program. So Grace, what do you think are some questions that students should think about as they are preparing for the interview, so that after they have been asked the questions, now it's their turn to assess whether this program is the right fit for them?
That's a great question. I personally love when students ask, like after we ask, what questions do you have? Students that have questions are always the greatest, because it's like you thought about it, even if it's something simple. So a question that I like to ask is, your program, and specifically, do you guys have official or unofficial mentorship programs? Because professional school is hard. It's a challenge. It's a different environment. And having somebody a year above you, 2 years above you, to guide you through, encourage you, even if it's just send a good luck text message, or tell you about, oh, that research is something that I think you'd be passionate about. Mentorship is one thing that's always on my mind. So I always ask, do you guys have official mentorship program where we get matched with somebody, or do we find our mentors on our own? And it's fine both ways, but I like to have both options, things that I'm matched with through the institution, and people that naturally gravitate towards me and I can help on the journey as well. So that's one question I ask. I also love to ask students that are already in the institution. I ask them about their work-life balance, but like school life balance in a sense. Do you have time to go and grab coffee with friends every once in a while? Do you guys have time to, go to the park for a day at a picnic and walk your dogs? Or, do you guys have a nice balance between the schoolwork you have and your social life or service or activities outside? Because that's important too, whatever city you'll be in for your institution, you want to be able to enjoy the city too. You want to be able to enjoy your classmates as well. Things like that are super important. And lastly, I like to ask, what is like the retention rate of certain institutions? Like,
interesting.
Do you start off with 250 and end with 200? Like, that's alarming. Or is it much more like a 95% retention rate or a 90% retention rate? The higher, the better. Because it tells
and that shows that they're putting a lot of nurturing into their trainees, right?
Exactly. They're putting the effort to keep their students, whether it be tutoring programs or whether it be facilitated discussions where the professors, their office hours, things that will keep students at the institution, whether it's even scholarships, because sometimes financially it's expensive. So I always ask about that too, and what steps they have in place if a student needs to step away, but encouraging them to stay, or making accommodations for every circumstance that students have.
Definitely. And this goes back to our mission, because we're addressing the social and emotional support that our trainees receive, because that whole pipeline, it gets harder and harder the further you get into higher learning. The support, you become more the minority, and as underrepresented minorities, you become more of that the higher you go in your education. And it's really important to understand what support and social support you have to get you through. Sometimes that isolation can really, really get to you. And one thing that Grace mentioned, because she's a pharmacy student, but a lot of her support networks were mainly where?
In medicine.
Medicine, right?
Yeah.
And so it's the idea of when you're on an interview, try to, ask about any sort of cross-disciplinary interactions. It may not just be the medical student cohort that you'll have exposure to, but ask, what opportunities are there to mix with, other professional groups in the area and on campus. So I think that's a really good question too.
Definitely.
Yeah. So let's talk about format of interviews,
That's
so
exactly what I was about to talk about.
We're on the same page. Love it.
But yeah, diving into formatting a little bit. So of course there's a virtual space, so I'll focus mainly on that part, but there are traditional interviews, where you're individual, it's just you and one other person or two other people, it might be a dean, a professor from an institution. There is, group interviews where it's a group of you, 6 or 7, 5, or, a couple of you all, and you have 1 or 2 people you're talking to. And then sometimes there are things called multiple mini interviews, where it's multiple scenarios. It's very scenario based, and you have to answer a question or a scenario in 5 minutes or so. So diving a little bit deeper into that. So when you have an individual one, I feel like the most important thing is making sure you're prepared in regards to knowing what your personal statement said. You wrote it, so you should know what it said, knowing what your CV says, because they'll probably ask you the simple things like, oh, I see you volunteered at this clinic for 5 years. Tell me about that experience, or things like that. So being very versatile with that and just letting the conversation flow, because it's 1 or 2 people. When it's a group interview, however, a lot of people want the spotlight to be upon themselves. So if the spotlight is just on you, it's not really showing your communication skills and your ability to adapt to a group. So being intentional when you're in a group interview to let people speak, ask them their opinion and see from their viewpoint and their aspect is one thing I strongly recommend. Be comfortable, make friends, have your viewpoint, but do not hog all the attention. And then with the multiple mini interviews, this one can be a little bit more challenging because it's quick in the sense that you have different scenarios and different doors. You open one door and they'll give you a scenario. You have 1 minute to read it. And it might be, tell me a time where you were empathetic or you expressed, or you tell me a time where you're empathetic, can be as simple as that. Or describe to me why you're passionate about the field of medicine. Mm-hmm. You get a minute or 2 to read it. You come into the room. You'll have 2 minutes to address the scenario to whomever is there. And then that's it. You move on to the next one. So you have a really short amount of time to tell why you answer your question with efficacy, efficiency, and just being who you are. And in those scenarios, I said, go for it. Whatever's on your mind, think about it, but try and see it from the viewpoint of being empathetic. If it's asking you, tell me about a time you helped a friend, make sure you emphasize that you were feeling for their pain and you wanted to be there for them, or if it asks you why are you passionate or why you believe in this stance versus this stance, state your viewpoint, but state the opposite viewpoint, validate it, and still stand strong in your own viewpoint. Right. But those are the main different types of interviews. They can vary, but My one hugest suggestion is whatever interview you have, look it up on Google. It'll give you all the questions. It'll give you examples for pages and pages about questions. That's always what I do. Look up the questions, practice with somebody. Don't be afraid to make the mistake while you practice, so it doesn't happen the day of your interview.
Yeah, definitely. And even if it does happen, be self-aware enough to just acknowledge it. Again, one of the characteristics we're looking for in trainees is, are you willing to acknowledge when you make a mistake and just owning it, understanding how to do differently so that you have a different outcome, So, but yeah, it's always preparing as best as you can, but also knowing that, it's important to just know your humanity. So as we close, we've talked about just thinking about interviews within the bigger context of the pathway to your degree, whether it's into medical school or a graduate school of some sort, and then thinking about the emotions that are related to the interviewing process, some of the thoughts and concerns that you might have, having a confidant you can share those with so that they can help you gain perspective on how to address those feelings and emotions and anxiety. And then we talked about preparing for the interview, how to prepare for an interview and what to think about, knowing that the interview starts as soon as you make contact with anyone from that institution. Even your email correspondences can be reviewed as well too. So being mindful of that. And then we talked about different types of interviews and formats. And so lastly, we'll just end with the whole idea of being prepared. It will not hurt to know the responses to these 5 questions. These 5 questions at some point will be asked you. The one is, tell me about a time you worked under pressure. Number 2 is, tell me about yourself. Number 3 is scenarios about your interests, and number 4 is how you measure success. And number 5 is, how do you recover after failure? I think if you have the responses to those questions, it will prepare you for any type of interview you enter, because it really goes to show how well you know yourself, how well you're aware of your limitations, what makes you thrive, what kind of gets you down, and how you overcome those barriers. And I think at the end of the day, we're just looking for people who are willing to grow and find opportunities for growth, but are also having some, good motivation to really pursue success. So thank you guys for joining us. Thank you, Grace, for sharing your expertise. And we look forward to other opportunities to kind of discuss what you have as points of discussion as you continue your pathways to success. If you have any suggestions for a topic, if you'd like to be a guest on our show, we're about to have some wonderful guests coming up. Please reach out to us at info@austinbpa.com. Again, that's info@austinbpa.com. If you have any suggestions for us to address, if you like what we're talking about and you feel that it resonates with you, feel free to reach out to us, like us on any social media posts that you listen to this or hear this on or watch this on. But all in all, we really wish you all the best as you continue your pathway. Take care.